Hi Year 10, this is the second lesson for this week. Last lesson we were looking at Vesalius and why he was so important to the Renaissance period. This lesson we're going to move on to another key individual. His name is Paré. This lesson's objectives are to be able to recall the problems with cauterisation in the Middle Ages, to understand how Paré helped the development of medicine, and to evaluate the impact of Paré's work. So what is cauterisation? For our first learning objective, we need to be able to recall the problems with this treatment in the Middle Ages. If you're a developing student, using the pictures on screen now to help, explain what cauterisation is on your whiteboard. Use the keywords oil, metal, hot and wound. If you're a secure student, watch the video and explain 2 problems with cauterisation. If you're a mastered student, if there were so many problems with this treatment, why did medieval surgeons use cauterisation as a treatment? Take a picture of your completed task to upload onto class charts. So we should now know about cauterisation. It's a treatment that was to burn the wound with a red hot iron or to pour boiling oil onto it. It may have worked in some cases, but you should now know that this often did more harm than good. So for our second learning objective, we need to be able to understand how Paré helped the development of medicine. What you need to do is open the Word document that's labelled Paré and read through that information carefully. If you're a developing student, you're then going to complete the quiz that's on screen now to test your knowledge. If you're a secure student, draw 2 images to summarise how Paré helped the development of medicine. If you're a master's student, which section, was it forensics, sealing, wounds or surgery, did Paré help improve the most? Explain your answer. For this task you don't need to take a picture to upload onto class charts. So you should now know a bit about Paré and his work. We should know that he was an army surgeon. He was using ointments instead of cauterisation to treat his patients. He also improved the treatment of amputations. He invented a method of tying off blood vessels with threads, and that's called ligatures, which is less painful than cauterisation and reduces the chances of patients dying. So for our third learning objective, we're now going to evaluate the impact of his work. On the screen now are 4 impacts of Paré's work. Developing students. Which of the impacts do you think is the most significant? Explain your answer. Secure students. Give Paré a score out of 10. Explain your score with reference to his work. Mastered students. Paré's work had a greater short-term impact than long-term. Do you agree with this statement? Take a picture of your completed task to upload onto class chart. That's the end of our second lesson this week, Year 10. We should now know about Paré and how his work improved surgical techniques. What you need to do now is to upload pictures of your completed tasks. For task number 1, you need to upload a picture of your explanation of what cauterisation is or its problems. You don't need to upload anything for task number 2. And for task number 3, you need to upload a picture of your ranking of Paré's impacts. Well done for completing all your work this week, Year 10. We look forward to reading it.